Hi, Dr. Todd Sullivan from Nova Chiropractic and Acupuncture. In today's video, I'm going to show you how to treat shin splints from home. So shin splints is an overuse injury where the muscles in the lower leg, the tibialis anterior and the tibialis posterior, the muscles that attach along the shin bone called the tibia, become very tight. And then what happens is where they attach to the bone, that connective tissue gets irritated and then becomes painful. So in today's video, I'm going to show you how I would suggest treating it at home. So when dealing with shin splints, the first thing I want to do is decrease the pain and irritation. So the best way to do that is to ice the affected area. So you want to ice it for 10 to 15 minutes at a time, take it off for an hour, and then reapply it for 10 to 15 minutes at a time. Repeat this cycle 3 to 4 times to decrease the irritation and the inflammation, and that will get down the localized irritation. The next thing we want to do is we want to treat the tightness that is causing all that irritation, and we'll show you how I would recommend doing that at home. To treat shin splints at home, what you're going to do is you're going to take a lacrosse ball or any kind of harder ball about the size of the diameter of a lacrosse ball, and what we want to do is if we're working the back side of the muscle, the tibialis posterior, what we're going to do is we're going to take that ball and we're going to start off gently and going up and down the back of the tibia, work those tight spots. And what you'll want to do is you want to find some of those tender areas there and roll back and forth 5 to 10 times and then move on to the next section. Start off gently because it's going to be irritated, and then as you loosen up the muscle tissue, you'll be able to get in deeper and deeper and just go up and down. And again, you want to go kind of right above the ankle bone, this whole area here, and this is called the soleus and the gastroc muscle here, and then the tibialis posterior is right behind the tibia. The tibia is again the bone that gets affected, and again the muscle where it attaches right on the backside is what causes that irritation and pulling right on that section there. So if we loosen up this whole muscle here, that'll take the pressure off. You can also get anterior shin splints, which is caused by the tibialis anterior. This muscle brings your foot up like that. It dorsiflex your foot. And the pain typically pattern-wise is right here. So same thing, what you would do is take that lacrosse ball that works the best and just go up and down that tibialis anterior muscle, working it, finding any of these tender areas, and just go up and down. And again, start off gentle, work up in intensity to get into that area there. So that's how you would treat the anterior shin splints with the lacrosse ball. The other tool you can use at home to treat shin splints is a massage gun. What we're going to do is we're going to take the Hypervolt Go and we're going to go up and down the posterior part of the tibia right into this tibialis posterior. Same thing as a lacrosse ball. Start off very gentle and then kind of work on any of those tender spots. You'll feel some knots in that area, and then also work a little bit posterior to that part into more of the calf, the gastroc muscle too. And again, you can start right above the ankle area. Just you want to definitely avoid being right on the tibia or the bone there. That will cause pain and discomfort, especially when you're in the acute phase. And just go up and down here, concentrating on any areas where you feel increased tension and tightness. And again, also make sure you kind of work a little bit more into the actual calf muscle in the back. But this is all a really good treatment for at home. And again, just start off on the lightest setting. This is level 1 for the Hypervolt Go. I would recommend you either use the ball attachment or the flat attachment. That won't get in too deep, but it will also definitely loosen this up. Now again, to work the tibialis anterior, what we're going to do, same approach, we're going to work this top side right on the back side of the tibia. And again, just avoid being right on the shin because that will be uncomfortable. And then also you want to make sure you also hit the outside part too. Sometimes when we're doing this, we'll also add in some active motion so she can bring her foot up and then point and up and point. And that just helps to accentuate the treatment and get a little bit deeper. So the lacrosse ball and the massage gun are a great way to treat shin splints at home. You want to perform this 2 to 3 times a week, and then definitely make sure you ice after your activity to help calm that area down. But the combination of the ice and the massaging the muscle will help loosen this up, and it will help get your shin splints better. So if you're suffering from shin splints, give our office a call at 703-912-7822 or schedule online at novacarewellness.com.